Hi, good afternoon, everyone, and welcome to today's County Health Rankings and Roadmaps national webinar entitled Green Communities and Equitable Economic Development, Improving Well-Being Through Sustainability, Broad Inclusivity, and Innovative Collaboration. County Health Rankings and Roadmaps has helped to shape the conversation around the social determinants of health as our model's been used and become a valued resource for people around the country, and we are expanding our resources to support communities in their equity work. Today's webinar highlights this honed focus on equity. So I want to acknowledge that County Health Rankings and Roadmaps is a program based at the University of Wisconsin Population Health Institute, and it's a collaboration with the Robert Wood Johnson Foundation. This program is the result of the contributions of many colleagues and partners in Wisconsin and around the nation. So I'm going to ask my guests and colleagues and myself to turn our cameras on. And attendees can see that we're all real people here today. So I wanted to just introduce ourselves. My name is Justin Rivas, and I'm a network strategist at County Health Rankings and Roadmaps. I'm joined by my colleague, Erica Burrows-Girardi, an action learning coach. Hey there, Erica.
Hi everyone, and thank you for joining the webinar today. I will be answering your questions. So I just want to remind all of you, if you have a question, go ahead and enter it in the question and answer box. I will be attending to your questions, and also we have some guests who will also be trying to answer your questions in real time. And if we have some time toward the end of the webinar, we'll try to lift some of those questions up for our guests to answer. So thank you, Justin.
Oh, of course. Thanks, Erica. My other colleagues joining me today are Joe Hinton. Joe, you want to say hi to everyone?
Hello, everybody. I am the typing fingers behind the chat box, so I look forward to interacting with all of you there.
Thanks, Joe. And our technologist, James Lloyd, is here today, the ever-faithful James. He'll be taking care of any technology snafus. You can chat him as well if you have any questions with tech issues during the webinar. But now I'm pleased to introduce our guests today, starting with Renee Mendez, who is the city manager for the City of Gonzales. Renee, you want to just say hi to everyone?
Hi, everyone. Thanks for the opportunity to engage with everyone.
Great, thanks, Renee. Renee has over 25 years of state and local government experience. After college graduation, he spent 5 years with the California Legislative Analyst Office. Following that, he spent 5 years with the Solano County Administrator's Office. And before coming to Gonzales in 2005, he spent the prior 8 years as the County Administrator for the County of Inyo. He holds a BA in economics from Cal State at Stanislaus and is a Master Arts degree in public policy from Duke. We are also joined by Carmen Gil. Carmen, you want to say hi?
Hi, everyone. Excited to be here with all of you guys today.
Hey, Carmen, thanks for joining us. Carmen is the City of Gonzales' Community Engagement and Strategic Partnerships Director. She has a long trajectory of working with community in various capacities and has a keen ability to develop relationships that go beyond transactional to be transformational, which we'll talk about today. Before coming to the City of Gonzales, she served as the Health and All Policies Manager for the County Health Department, where she raised over $3.5 million for programs that advanced equity and supported resident leadership and capacity building. There, she led the development of the health and wellness element for the City of Gonzales' general plan. She's worked through private and public partnerships to address issues of housing, homelessness, health access, and infrastructure, just to name a few. And we're also excited to have Elizabeth Diaz here today. Elizabeth, you want to say hi?
Hi, everybody. Thanks for having us here.
Of course, and Elizabeth is the Vice President of Armand Nasco Public Relations, a public relations agency located in Monterey, California. Elizabeth's been with the company for over 23 years and has been a communications consultant for the City of Gonzales since 2015 to really help communicate the story of their work. So thanks everyone for turning your cameras on. You can click them off now, and we will start to dive into the content. So some learning outcomes for today's webinar. By the end of today, we're hoping that attendees will be able to describe the intersection between economic development, climate and environment, and equity. We also hope that we can identify the process for launching a green initiative that brings together environmental responsibility and social equity. And we're going to lift up a lot of strategies for authentic community engagement, innovative collaboration, and multi-sector partnerships. So I just want to share that there will be an exciting learning opportunity after the webinar today. Immediately following today's webinar, we'll have an interactive discussion group that we've been doing a lot recently with our webinars if you've joined us. These conversations give you the chance to be face-to-face with other attendees and share what you're doing locally, as well as ask questions of other participants and our guests today who will be able to join us. We are pleased to be able to offer these sessions in partnership with Healthy Places by Design, and Joanne Lee will be leading that as the lead facilitator after today's webinar. There'll be a separate Zoom link that you'll need to click on at the end of the webinar to join that discussion group. Okay, so I want to get to county health rankings and roadmaps and our kind of goals and what we do, and I'll go over these kind of briefly because I know we have a lot of regulars on our webinars. We really have twofold outcomes here. The first is to improve health outcomes for all, and this includes both how long people live, but how well they live as well, so quality of life. And the second goal is to close the gaps between those with the most and least opportunities for good health, thereby advancing health equity. So what do we mean by that? Health equity is the notion that everyone has a fair and just opportunity to be healthy. Advancing health equity requires action. We must remove obstacles to health such as poverty, discrimination, and their consequences, including powerlessness. And we must create access to good jobs with fair pay, quality education and housing, safe environments, and quality healthcare for everyone. These are some issues we're going to talk about today. If we want health outcomes to improve, then taking steps to remove these obstacles has to be fundamental to our work. So I've kind of explained just quickly the what and why of county health rankings, and here's kind of the how we do it. We really go through 4 different areas in which we help connect with communities. That's through data, evidence, guidance, and stories. We use data to reveal the factors that influence health. We're going to share a lot of evidence today, and evidence to highlight the strategies that are working in communities. We use guidance to put those strategies into action, and then we like to tell the stories of real-world experiences to inspire and to inform your own efforts, which is really the majority of today's discussion. So here's the county health rankings model, and again, I know this is nothing new to some viewers, but I know it is to others. And we have a new interactive feature I want to lift up. So what this model shows us is that there's a lot more to healthcare than just what happens in the doctor's office, right? We can see that, in fact, policies and programs influence a whole myriad of health factors, which include health behaviors, clinical care, like I just mentioned. Mostly social and economic factors are weighted the most in our models. So we talk about things like how education, employment, income, community safety affects health, which we'll discuss today, and also the physical environment, which will be a key topic. How do these things lead to health outcomes? Well, that's what the model shows us, right, in the length of life and quality of life. The interactive feature of this model is now on our website. You can kind of click through this model. You can look more specifically at these health factor areas. You can choose specific measures and see exactly how we look at these data points within our own communities. This is the backbone for the county snapshot, which a lot of you have used on our website. So for today's discussion, let's start with some broad systems thinking. Let's consider the context of how economic development, environmental responsibility, and equity intersect. Over 25 years ago, John Elkington coined the phrase, the triple bottom line, which many of you might have heard of. It's been adapted by the private sector to better understand and account for social and environmental responsibility by looking at the intersection of people, planet, and profit. Although the model has been around for nearly 3 decades, Elkington admits in a 2018 Harvard Business Review article that this theory was first developed to really think more broadly about society and what kind of systems change would be needed to transform capitalism. He wanted to better understand the social and environmental values added or values destroyed by economic policies. Since then, the model has been co-opted a bit to become a private sector accounting system and used by corporations to look at their financial decisions related to these areas. But it's a relevant model when utilized with its original intention to understand the intersection of these 3 areas when crafting sustainable approaches, which is why sustainability sits in the middle of that Venn diagram. I drew the circle around the 3 to convey that these 3 areas operate in a system that is dictated by public policy and a regulatory context, i.e. government, right? So this really sets up well the importance of the public sector and government leaders who we'll hear from today. I want to share also one external resource relevant to our conversation. We shared this report before from PolicyLink on a previous webinar when they joined us as a guest, but the strategies in this report are so relevant for today's webinar and the content's so relevant that I wanted to circle back to it and share it again. As a nation, we're really at an inflection point in which we need to address equity and how groups are included in economic growth at all levels. Racial inequities in income, employment, and opportunity are wide and persistent. This report which is called Key Strategies to Advance Equitable Growth in Region, lifts up so many great strategies for equitable development work. So these are the kind of 7 bucket areas on the slide that the report goes into much more detail with specific strategies within each of these bucket areas. I'll read through a few of them, but maybe at this point in time, as you read through them too, you could chat in which one to the chat feature, which ones look most relevant or important or interesting to you, which ones are you maybe already doing some work in your community, and you can maybe even share some examples of that. So a few of them include growing industries and businesses that create good, accessible jobs, right? Supporting entrepreneurs of color and business ownership in low-income communities, leveraging regional investments and planning for equitable growth, removing barriers, again, coming back to that equity component I talked about earlier, such as criminal records, undocumented status, and structural racism and implicit bias. A few more include connecting workers to job opportunities and strengthening the pre-K to career education pipeline, which is a big theme in Gonzales' story, which we'll hear about. We'll come back to your chatted responses in just a bit to share back some of your examples. So now let's take a look at some of County Health Rankings and Roadmaps resources. Our What Works for Health tool will help you find policies and programs that are a good fit for your community's priorities. What Works for Health, if you're not familiar with it, is a living resource of over 400 evidence-informed strategies. Each strategy is given an evidence rating to help you decide what's appropriate, and the evidence ratings convey the likelihood a strategy will work based on the best available evidence at the time. This is a living resource, something we update on a monthly basis and look at the new evidence and new implementation practices to give the best understanding of each of these strategies. In it, you'll find for each strategy a short literature summary that highlights the populations that it best addresses. You'll find outcomes it can achieve, and when possible, information about cost. And you'll be able to find some implementation resources as well. Importantly, there's a disparity rating aligned with most of the strategies that will help you understand perhaps an equity impact for each of the strategies. Really quickly, I just wanted to share one. So here's paid family leave, what it looks like on the website. And you'll see that this is an abbreviated version of it. And just some of the points I wanted to point out here is that there's the evidence rating up top. So this is scientifically supported, which is the strongest form of evidence, which means paid family leave would be a great strategy to take on. You'll also find a description of what those evidence ratings look like. Here you'll find the other components I mentioned, the impact on disparities, implementation examples, and a lot of resources about how to go about implementing the strategy. You can now access these strategies you've starred throughout your search in What Works for Health at the top right of your screen, kind of similar to like a shopping cart on our website. Once you've created a list of strategies that you're interested in and you want to explore further, you can download them to your computer, or you can email them to yourself or to colleagues. So a nice way to kind of curate your own strategies, if you will. This is a new feature, and I welcome folks to check it out and use it. So lastly, here's how to find a list of curated strategies and What Works for Health specific to today's topic. So you can keyword search these strategies. Again, I said there's over 400, so there's quite a few. You don't want to read through them all. But there's a tag in it in which you could search for climate change. This will bring up 31 strategies related to climate change and the environment. You could filter those 31 by topic or decision maker on the side. So if you wanted to look specifically at employment or housing or education, or if you want to look at the main players who's involved, the private sector, nonprofits, government, you could do that to narrow your search. For today's webinar, we're going to provide a reference table of some of these curated strategies so you can look into them more deeply. And coming soon, we're going to have a curated list of these strategies on the website, so stay tuned this fall. Lastly, one more What Works for Health resource. We have another report we've put together that's a curated report of social and economic opportunities. Again, very much aligned with what we're talking about today. These are broken down multiple strategies in the areas of education, income and employment, and family and social support. So we'll include this report as well as a resource, another thing to dive into later on. So now I want to bring back our guest, Renee, and we're gonna get into this great section of the webinar to really hear about the story of Gonzales, California. So welcome back, Renee. How you doing?
Good. How are you, Justin? Thanks.
Good, good. Tell us a little bit about Gonzales.
Yeah, well, as people can see on the slide, we're a small, predominantly Hispanic, Latinx, Mexican-American, young, ag-based rural community. And we're in the middle of the salad bowl of the world. So we're located in Monterey County, which is in the central coast of California.
Great, and tell us a little bit about the culture there, the Gonzales way, if you will.
Yeah, you know, residents take pride in what we call the Gonzales way. The phrase originally was part of a youth initiative that centered around providing a setting to allow our children to grow up in Gonzales with love, care, and connection. You'll see banners up and down our community, the Gonzales way, love, care, and connection. But over time, it caught on to really describe everything we do and how we attempt to engage. It became the way people talked about how the city moved with our approaches, our focus, and determination of not giving up, and of, more importantly, not being willing to accept the limitations of our small size and rural location. To really embrace, and has embraced over time, everything we do.
That's great. And I think that this kind of speaks to your connection to the community. So tell us a bit about really the backbone of your work is your community engagement, I think. So please share.
You know, it's a culture of positivity and engagement. We attempt to engage at all levels. We recognize that our community and our residents are our best asset, and it's our strength. So we will engage with our youth. So we have a very robust youth program that we will talk about a little bit later. We are trying to engage with our senior citizens and engage in a way that's understandable, right? So English and Spanish, but also being cognizant of the fact that simple translation doesn't mean that you're connecting. A lot of the processes and systems we have in this country, if you're from another country, you might not have a foundation to even begin to understand them. So it's more than just translating and speaking the language, right? It's really trying to inform and educate, and more importantly, listen to what our community is telling us.
That's great, Renee. And I don't know if you mentioned it in the first slide, but the community really is like 90% Latino, right? It's predominantly Latino community and Spanish speaking, correct?
That is correct. And it's a combination. We have first generation, second, third generations. We have a Latino community that's been here for a long time. We have others that have just immigrated to this country recent immigrants. We also are beginning to see other from the Oaxaqueño community and other parts of Mexico where they don't even speak, the Spanish is not their first language. It's their dialects and so forth. So the communication with these groups, it becomes even a lot more challenging.
Yeah, it really speaks to how you've constantly adapted, I think, in your story. So let's kind of shift this to some of the environmental work that you're doing in relation to working with the Latino community. So tell us a little bit about what Gonzales Goes Green, or G3 initiative is, and kind of how it came to be.
So it's an initiative, an outgrowth of the city's vision statement that we adopted in 2005. And I will tell you that looking back at it now, over 10 years ago, we started simply with the way of trying to differentiate ourselves from other communities. But it was too mechanical. It was too process procedure oriented. So we quickly pivoted to how best to engage with our community and be relevant to our community, which I think is really important. No one wants to destroy the planet, but with all the challenges faced by our residents every single day, how is it relevant? How does sustainability, environment, put food on the table, pay the bills? So we began to really listen to our community, and we had some misses early on. And our triple bottom line, like you talked about earlier, for us became environmental responsibility, which is the planet, economic vitality, which is profit, and social equity, which is the people. So that became our guiding G3 principles that we've built from since we started.
So let's start with that first one. Can you give us just kind of the evolution of the environmental responsibility part?
Yeah, it really had two distinct but connected efforts. One was the policy level discussions and actions, like adopting for us a sustainability element in our general plan, a climate action plan, a focus on renewable energy, and looking internally at ourselves and the organization, right? So it's it's hard to ask our community and our residents to join us on an effort when we don't practice it ourselves. So it really became sort of from a policy process level. That was the documents. And that resulted in solarizing our facilities, coming together to stand up a community choice aggregate model here in Monterey Bay. So our tri-county region with Santa Cruz, Monterey County, and San Benito County. So we started doing sort of that sort of process, more governmental effort, right? So that was one step. And then second step, sort of addressing in the next slide, was how do we connect that to our community? So environmental responsibility, right? So we started going into our community and what resounds with them. And so on this slide, you see, our sustainability coordinator, she's addressing a group of young kids there. So our Environmental Leadership Academy, we really work with the schools. We started doing sort of working with our community on no straws and some of the recycling programs, and really attempting to adapt what we did to what resounded with our community. No size or message fits everyone. And, that's something we had to learn along the way. The turbines there you see are an example of our partnership with our private sector. Taylor Farms was an early adapter. They were the first fresh food facility to become a true platinum certified. So they have solar, cogeneration, and wind. Del Monte also now has solar. So it was not only with our community, but all levels of our community, our residents and our private sector.
And Renee, what I love about this story is just the authenticity and leading by example with local government. I mean, it's not paternalistic coming in and talking about from the government what community and business has to do, but doing it yourselves with your own buildings and your own work. I think that's really fantastic.
I think it's a credibility effort, right? It's an important to be credible and authentic, and learn and listen along the way.
Exactly. So how is this translated to some of the economic vitality and even the public-private partnerships that you've built?
So at its core, it was a sort of a willingness to engage and partner and adapt our processes to take advantage of opportunities and eliminate or reduce barriers. That does not mean that, we always agree. Certainly, as a city or a county, we have responsibilities. We have laws that we have to follow. We have regulations. Many times we are the regulatory agencies. So that doesn't mean that goes away, but it does mean that we attempt to understand and really work with our businesses. So economic vitality, in a span of 10 years, there's been 1,500 jobs created in our community. And when you think about we're a community of 8,400 people, that's fairly significant. They're good paying jobs, and we run the gamut all the way in our health, all the way to some of our ag tech. So we're really focused on trying to bring, you hear a lot about livable wage jobs and so forth, to really focus on trying to bring good paying jobs. And I think from a policy perspective, or city council or policymakers, over time, you can see it really in our trends on our property taxes and some of our sales taxes, which is our growth in our tax base. And so the property tax annual growth, you will see obviously in 2008, like a lot of communities, we took a huge dip, but this was all residentially driven. In Gonzales, we're about 50% housing, 50% business and our industrial park. So you see a sort of a nice trend line up in the growth of our assessed values in our property tax, which directly translates into resource and revenues, right? That the city uses to provide critical and essential services. We saw a similar pattern, or we see a similar pattern in our sales tax. Our sales tax growth has gone from about $500,000 in 2009-10 to $1 million today. And you see sort of a nice trajectory up. And so from a policymaker's perspective, there's some real good proof points that, this is resulting in an increased tax base. And this is not a result of increased taxes. this is a result of working deliberately and intentionally to attract the private sector, the companies that share our values, that want to be partners with us, and they bring the jobs and they bring the growth that comes with that.
Right, so it's not just increasing the tax percentage amount, but it's increasing the growth overall in the community.
That's correct.
Hence the growth, yeah. This is fantastic. I just wanted to check back with Joe, because I know we had some action in the chat. Did you want to maybe share anything from the audience that has been shared in?
Sure, Justin, thanks. I will scroll back up in the chat because we've had a lot of great conversations going on. And I'll just say, you know, that we had early on a lifting up of supporting entrepreneurs of color and business ownership in low-income communities, raising the floor on existing low-wage work. Those were both identified by Felicia. Kim identified growing industries and business. Lots of folks focusing on creating job opportunities and removing educational barriers. So I really appreciated reading some of those insights.
That's great. And thanks for sharing, everyone. And hopefully you can bring some of those insights to the discussion group a little later on. And thanks for sharing out, Joe. I just wanted to pause. I know we went through, you know, a couple graphs. People need some break after some graphs sometimes. So it was a good point for that. So let's get back to the third component, Renee, which is really, you know, how this work is translated to the people, and talk about the social equity that's happened.
Right. So this is really the area that I think has been the most sort of rewarding. You know, we all come to our jobs and have the commitment necessary to do the work that needs to be done, but sometimes it's really hard to see the results, and they take time. So the social equity, this is also can be the most frustrating part, but the social equity piece, I mean, one of the chat was about education and comments. You'll see here, Gonzales Future Focus. So we have a robust engagement with our schools where we, you know, prioritize positive next steps. And I say that way intentionally. Not all seniors go on to college. Some of them go on to technical schools or go work directly. We have a couple of seniors that have gone work for their small business. Their parents own small businesses, so they're going to take over the businesses. So we attempt to reward all of that and just call it out. You see sort of the internet. So we spend a lot of time on trying to minimize or eliminate the digital divide in Gonzales. And I think we've done a pretty good job. Every household in Gonzales has access either to, if they can pay for it, robust broadband, or if they're challenged on that, the city provides a free hotspot, free in that, you know, it's paid from city funds, but every household gets access to one hotspot to be able to use. And so that's a couple of sort of the social equity issues, and a lot of it is not on this slide, but some of the BLM conversations that's been happening. The fact that we have the resources and intentional approach has allowed us to have those conversations in a healthy, respectful space. That's helping inform city leaders and also helping us, you know, connect with our community even more.
Yeah, that's great. And this hotspot example was evolved because of a private-public partnership, right?
That's correct. We ended up developing a partnership. So it's a three-way partnership. We have a partner with T-Mobile. We have a partnership with our school district. So our school district early on, this was before the pandemic hit. It was just fortunate that we were doing it, you know, we were rolling it out when the pandemic really hit all of us. The school provides the devices. So the Chromebooks or the pads and so forth, the school focused on that, and the city focused on the access. So if you think about two separate, distinct organizations and policy bodies partnered to try to maximize, you know, scarce resources, and neither one of us tackled all of it by ourselves. So this is really a three-way partnership, the result of the effectiveness of the hotspots.
Yeah, I think that's just such a great example, and also when you commented on defining success in different ways for youth, I think is just such a wonderfully kind of pragmatic approach to knowing that there's a lot of good jobs and potential futures that don't necessarily involve going to four-year college for everyone. And adopting that as a reality is great. So let's kind of talk. You've really have taken on this systems approach, which I was defining a little earlier, and maybe you could just kind of share, how you went about it or some components of it.
A lot of trial and error. I mean, I think early on we had to learn, participate in the efforts that best fit your community. And I think the best way of articulating that is trying to communicate, listen, and understand your community. Not every effort or every system, no matter how great and how great results it might have had in other communities, maybe it's a great fit. So for us early on, it really became health and health policies and HIAP. If you think about our sustainability and our intention, the HIAP process really captured and allowed us to sort of capture a holistic approach to what we were doing. And so we focused on that, and then we launched on Bright Beginnings, so it's an early childhood initiative, K through early childhood education. We've had a lot of efforts on that. So those became sort of our two approaches, be data informed, try to get the data, which frankly has been one of our challenges along the way, is making sure that we are measuring ourselves, setting up the right checkpoints in the data and understanding the data. And I'm just going to leave the group with one other, there's a lot of agencies, partners that are willing to step up and help, but you have to be the one that's willing to take the first step, be proactive and lead, and then things start happening. So I would encourage folks not to be afraid to sort of take the first step, and then invite your policymakers. And a great way of doing that is by, developing agreements, cooperative agreements and so forth, where you engage your policymakers at the policy level. So they're a part of the entire journey with you. They're providing direction, but they're also the touch points back to them at, regular intervals.
Yeah, I think your message about kind of frequency of engagement, both with policymakers and with community members, was really important. I have a funny quote from one of our planning calls for the webinar where Renee said, we can process people to death and not accomplish anything, which I think is finding that right frequency of touch points, right, in developing that engagement without overtaxing people pretty much.
Yeah, and it's important. People are busy, right? They want to be engaged, but they want to be engaged in meaningful ways.
Right. So let's really shift to the health part here and tell us a little bit more about the HIAP process. So
for us, it resounded well with our community and policy, but we are a small city. So for us, it was finding the right partner, and the partner for us was Monterey County Health Department. So we engaged with them in a partnership where we funded internship positions. The health department staffed and led the community engagement effort. So I say here, get out of the way of the process. Sometimes that's the hardest thing to do, but letting it or just develop naturally, sometimes is the best thing you can do, in having the right partners and people to help you. So that resulted in a health and wellness element in our general plan. I think we're one of the few that have one in the state, through a deliberate community engagement process with a committee of residents. The meetings were in Spanish and or English as necessary. We recognized early on that translating, when you're having these types of engagement efforts, the engagement suffers when you do the translation back and forth. So it's better to address it in the language that resounds with the community members participating. And so the health element in our general plan is now helping us inform how we're going to grow our community and develop our community.
That's fantastic. So you would host meetings entirely in Spanish and lead them in Spanish, correct?
That's correct. And even in the lead them in Spanish, present the documentation in Spanish. Actually, Carmen, who you introduced earlier in the session, at the time worked for the county health department, and she was the lead on this effort with us and with my community development director. So we did it in Spanish. The documents presented in Spanish. The report that went to the planning commission, through our process, and ultimately the city council, the community members provided input and support either in Spanish or English. So we really try to capture, the feeling of really what our community was asking of us, which is sometimes lost in the translation. Sometimes the emotion and the feeling of people is kind of lost when you translate what they're saying.
And I just think it's great, and it speaks to the great staff you had involved too, to be able to literally translate in the language what was learned, but also translating what is learned from the content of the meetings, not just the language that was shared. So I think that speaks to your success. And then also, I just wanted you to maybe speak to the real important connection of health and city government.
Yeah, I think it was interesting to us that this connection wasn't more intuitive, but when you begin to peel it and really look at what it means, quality of life, walkable communities, livable communities, and the connection to health, and you talked about it earlier, is more than just, going to the doctor, which is obviously important. It's more than having that. It's also about a quality of life. So we activated around a health assessment that was done. And one of the things that we focused on that we thought we can handle was increasing access to healthcare. So again, we partnered with the local property owner. We reached out to the private sector, and we approached it like we're trying to recruit a business. So we approached trying to increase our access to health, like recruiting, a big box retailer or some other type of big company. And when you approach it that way, it was in a language we understood. We now had an understanding of processes and procedures, and it wasn't kind of this nebulous sort of healthy thing. It was really about increasing access to our local health assets. And we also seeded some of a dental office and another health provider with a business loan to help them open up their practice here in town. So we approached it more like we were going to go out and attract business when we activated around increasing access to healthcare.
Right, you were leveraging resources and actually putting some money on the table, right? Which I think speaks to the commitment to it and builds trust, obviously, with the other organizations. I like this part of the story so much in Gonzales. So you want to shift a little bit to still government, but the role youth played.
Yeah, so this is one of the areas that I think if you look at it from a perspective, it's really something we're very proud of. We embarked on this several years ago, and our youth came together, worked with our police department and Monterey County Office of Education, which again speaks to sort of the partnerships and stuff, to focus around sort of their priorities. One of the priorities that came from our youth at the time was we want to be more engaged with our policymakers in our community. We want to understand how things occur. So that resulted in us activating around embracing them and bringing them into our policies, both us and the school district. So we put together Gonzales Youth Commissioners and Gonzales Youth Council, and the commissioners attend every council meeting. They're part of staff. So many of us have, formal council meetings or board of supervisors meetings, and there's the roll call, and there's just sort of those procedural steps. Well, our youth are part of that. They're part of the roll call. They're able to, the council and the mayor, I asked them to weigh in on policy discussions in front of the council, give their perspective and input. We spent a lot of time in paid and non-paid sort of internship programs. We've adopted a fellowship program, and we're engaging our school districts doing the same thing. So for us, our youth and our youth leadership has become a real structured program that now it's part of what the community expects. We've been doing this since 2013, but now if you talk to people in our community, some will tell you this has been going for a long time. So we've been able to activate and bring our youth into our processes, and they have brought forward recommendations of social hosting ordinance. They were an integral part of when we were discussing cannabis in our community, and they've set up We've had some amazing youth commissioners do some incredible programs. Youth across the nation are amazing, and you invite them and you're authentic about engaging them, the results will be pretty phenomenal.
Yeah, it's such a great part of your story. Thanks for sharing, Renee. And I want to move on to kind of, we can't deny the fact that we're operating in a different reality right now during a pandemic, and just, speaking about government and health and how you've maybe had to make some shifts or adaptations because of COVID.
Well, like many communities, we had to shift and address COVID. But I think we found that our social equity mindset and community engagement efforts like HIAP approach, our youth engagement, and our Gonzales Way of Love, Care, Connect, which I haven't really spoke to a lot, but while challenging, frustrating, and exhausting at times, we were able to pivot and address some of the challenges in front of us. So like many throughout the nation, we address food, we try to address food, business assistance, rental assistance. So we did all those programs. But a couple of things that I want to highlight as a result of everything we've been doing was our Gonzales Youth Council, which I just talked about. They spearheaded and did a mental health youth survey, and we were trying to understand, kind of what our youth was feeling. And it was better. I think the response was really good, and it was great because it was youth asking youth. It was an adult asking youth in a much more sort of structured, process. So from that, our youth actually worked with Monterey Bay Community, CSU Monterey Bay, to put together a survey vehicle to do the survey and to interpret some of the data. And we're still going through all of that. I'm pleased that right now, because of some of the data, we're partnering with the school on jointly funding another licensed clinical social worker position for the school. So we would be adding more of that asset to our school. And the other thing that I want to highlight is our connection with our seniors. And I thought we were doing a great job before, but as a result of COVID, our staff, and we were able to, some of our council members stepped up. We were touching with our seniors. We were just calling in, checking in, every few weeks. And the level of engagement and information and connection with our seniors has increased tenfold just because of that. So that's one of the things now that we need to figure out how to continue, because during COVID, we're all doing things that are actually probably really good, and we should find ways to continue them after COVID is done. And those are a couple of areas where I think our knowledge base and our level of engagement as a result of COVID has improved tremendously.
Yeah, that's great. And I think how you really just keep spinning this to the positivity of the work you do. And I think that speaks to the resilience in the community. So I know you don't need to touch on all these points here, but just kind of some of these examples of how resilient you've been in Gonzales.
I think it's just the community. All our communities are resilient. And I think COVID really illustrates that. But I think it's also important not to take it for granted, and to constantly work with your community to develop the foundation necessary, right? So engage, listen, and take a longer term view. And don't get discouraged. Like any meaningful relationship, the process is going to have some ups and downs. And be willing to engage partners, maybe some sectors that you normally wouldn't engage. So I think the culture of resiliency is there. And I think whether it's COVID or any other major challenge, sometimes we forget it. Sometimes we forget that our communities are very amazing, and there's a lot of strength in the community. And I think that's really, at the end of the day, why resiliency has been such a great trait here. We're constantly learning from our community.
Yeah, it's such a great message. And I think it speaks to any community, regardless of size and resource and geography. I wanted to just kind of close up with just some of your kind of setbacks and challenges, and then most importantly, your successes. So maybe just want to talk, maybe Resilience Speaks here again too, how you bounce back from some of these challenges.
Yeah, understanding that there will be setbacks and challenges, and we won't always get it right. And sometimes our engagement efforts, like we did early on, we did for some of the audience who kind of know the Environmental Quality Act, there's a national NEPA Act, and there's California, we have our own, which is much more strict than NEPA. Our community, we were wrestling with this real challenging project outside of our community. And as it was going through this environmental review process, we realized that our community did not know how to engage, particularly our Spanish-speaking Latin, Mexican-American community. And so we did these trainings, right? We translated everything, we had Spanish, and 5 minutes into the training, we realized that nobody had any clue what we were talking about because there was no foundation. I spoke to that earlier, right? So we had to sort of pause and say, okay, what are we missing here? So those sort of things happen, and acknowledging them. And it's not only about shifting the organizational culture, but shifting the community culture and expectation, right? What does the community expect of their government or their leaders? And I think it's that, and just developing the trust and build meaningful engagement. One of my recreational coordinator, and I know you've heard this before, is sort of we move at the speed of trust, right? So it takes time. And sometimes the hardest thing to do is pausing and allowing something to develop. Sorry.
No, that's a great message. And I want you to just kind of take us through here with, you don't have to go through all the successes here, because I know we touched on quite a few in the other slides, but I'm just sharing, really what's come up, all this great work.
I think our access to healthcare is probably one of the things that has been amazing. We were under the rural average for, people resident per doctor. We are now over the urban average because of our success in healthcare. Our Taylor Health Center went from, it's a 19,000 square foot facility that's providing a ton of care that wasn't available here. Obviously, our increased tax base. And from a sustainability green, our gas emissions and our carbon footprint has, we've been meeting those challenges and we've been decreasing it. And then finally, for our community, just, we're creating jobs. Jobs are being created.
That's great, Renee. And I don't know if we touched on it earlier, but of course, Gonzales is a Robert Wood Johnson Foundation Culture of Health Prize winner. I know that was earlier on in the webinar description, but that's really the connection point here, is also being kind of a national example of doing this kind of work and sharing all the beautiful parts of your story that you've already shared. Do you want to finish off with any of these last lessons learned?
Sure. I mean, I think, relationships. I'm sure there's a much more technical way of saying that. But I think don't underestimate the engagement and the willingness to engage and the willingness to, take that first step. And then you also have to apply, monitor, and maintain an equity lens. It needs to be part of the culture. And that doesn't mean you're always going to get it right. It doesn't mean you're going to get, see everything coming. But I think if you maintain that equity lens when things go wrong, the pivoting and adjustment is easier and it's better to do. And I think it's also important to sort of apply and monitor how you're doing. Early on, we didn't do much of that. We're so busy doing that we weren't sort of, okay, what are we really accomplishing? What's really happening? So I think that's one of the lessons learned, is as we go forward, we've gotten better at that, and we need to get better at that. Intentionally engage, and again, look for opportunities to engage with policymakers. It's important to keep all levels of the organization and the community engaged as much as you can.
Well, that's a great message, and thank you, Renee, for sharing the story. And we'll have more time to discuss some of what you've done in Gonzales. So I know we've kind of just touched the tip of the iceberg. I do want to share a few more County Health Rankings resources before we get into the Q&A that align with what you've talked about in terms of building relationships. Partnership work isn't always easy, and there's ways to think about how to go about it in a strategic way. We have what's called a Partner Center on our website. It's a place where you can see all these important roles that different groups and sectors play in creating healthy communities. And you can learn more about what they care about and what they want to address in terms of health and how to engage them at our partner center. We also want to highlight some action learning guides. These are a new feature of self-directed learning that get into different areas you want to learn more deeply about that might be relevant to today's webinar, like equity, partnering with residents, community engagement, and policy change. Lastly, we want to hear from you, so please click on the link below in the chat to provide just a quick few questions evaluation of today's webinar, give us an idea of how things went, how things are going. And now I want to jump into some Q&A, some questions. So I'm going to turn it over to Erica.
Thank you, Justin, and thank you, Renee, for that fabulous storytelling of what's been going on in Gonzales. I will let you guys know that the question and answer box has just been totally lighting up. And Carmen and I have done the best we can to answer all of your questions in real time. I want to tell you to be on the lookout for that link for the discussion group. If you can attend the discussion group, we will probably have some time to really chat through some of the things that you all have been sharing in the chat box as well as in the Q&A box. But given our time, I do think I have a couple of minutes to get through a few questions, Justin. So I want to start, Renee, by asking you a couple of questions that came in even before the webinar. We try to honor those questions that come in with our registration process. And one person from Mariposa County, California, wanted to know, how do we engage city and county leadership on how economic growth advances health? And she, I don't know if it's a she, but the inquirer wants to know, are there best practices that you can share from your experience?
Well, I think for us, it was a starting point of understanding it complements and it enhances. So if you think about economic development and more opportunity of jobs and attracting the business, people have more jobs, have more ability, in theory would make more money and can access healthcare, more healthcare services. Then if you think about healthcare, it is a business as well. So I think one of the things that we've done is look at healthcare not only from a quality of life perspective, but it's a business. So for example, our Taylor Health Center, which I mentioned earlier, is a 19,000 square foot facility that's providing a lot of type of healthcare that wasn't provided, but more importantly, it's providing jobs. It's providing jobs in the range of $15 and to $67, dollars per hour, or more, depending of the doctors and so forth. So if you think about working with your leadership and spending some time to really look at for us, it was HIAP, as I mentioned earlier, spending some time looking at what of HIAP applies, what can resound with your community, and really focusing on that. Don't overwhelm your policymakers or folks with all the tenets of a process. But every single system's got one or two, three things they can really focus on. And if you can really articulate that, then the other pieces will come. And I mean,
that's helpful. Thank you so much. And speaking of salaries, we had one person from Denver, Colorado, was interested in what types of jobs can we expect in a green economy, and what are the range in salaries for those types of jobs?
Well, I think that really depends on the emphasis and obviously on the pace of where you live in the country. But for us, I'm going to give three examples. One in ag, per se, ag tech and renewable energy. So for Taylor Farms, which is a vegetable processing company, 82% of the jobs there, and we're talking hundreds and hundreds of jobs, salaries range of $40,000 to $70,000 a year. So that's that. And in ag tech, we have a highly technical farm equipment company that not only hires engineers and so forth, but hires welders, specialized welders, highly technical welding, and they'll train. And so we're working with our Cornell Junior College and our school to develop those pipelines. They're starting at $30 higher an hour job. And then in renewable energy, where you saw one of the slides, we're working on a microgrid project, And our company, our partner there, Concentric Power, is going to be bringing jobs anywhere from $60,000 to $180,000 annually. This is switches, solar, all of that kind of technology. So I think you're looking at the nature of, those are the salary ranges you're looking at. And so if somebody makes, $60,000 to $100,000 a year, are we now talking a livable wage, right? In some parts of the country, that would be phenomenal. In other parts, maybe they need to be a little higher still, but that's what we're seeing here.
Yeah, that's good to know. That was new information for me. Maybe I'm in the wrong career, but anyway, Renee, there's one other question. No, you know what? I'm gonna pause on that. So forgive me, folks. We're a little short on time, but I want to let you guys know, our folks from Gonzales, there's a lot of questions about youth and how youth are able to participate in the process, and Gonzales has served as a model for the youth participatory process. I would like for us to be able to discuss that in the discussion group, if you all are able to come to the discussion group. So Renee, will you be there?
Yeah.
Okay, great. All right, I'm going to turn this back over to Justin. Thanks, Justin.
Thanks, Erica. Nothing like putting our guests on the spot on the webinar. Well, yeah, we'll have more opportunity to discuss. So I'm just going to wrap us up here. So as I mentioned, Gonzales is an RWJF Cultural Health Prize winner, and they went through this process, and we're firing it up again this year. So there's a call for applications. If you'd like to share the story of your community and learn more about the prize application process and criteria, et cetera, please visit rwjf.org/prize. And these are due October 15, 2020, the call for applications. And it's a year-long process, and they get to come visit the community if you're a finalist. So there's a really interesting process to work through as a community and help kind of craft really your accomplishments, what you're doing. So here's the discussion group again. We're going to put the link in the chat. Please start jumping over there if you'd like to join us. Just remember to stay connected with county health rankings and roadmaps. We have our socials up here and our newsletter, which is really helpful to just stay kind of tuned in with what's going on. And just a big thank you again to our excellent guests for sharing the story, taking the time to tell us about Gonzales, California. And thanks for everyone for taking the time out of the afternoon to join us and sharing the learnings and maybe continue in the discussion group. So have a wonderful afternoon, and hopefully we'll hear from you soon or hear from you on a future webinar. Thanks again.